My major areas of interest are in pulmonary vascular disease. In fellowship, I was lucky enough to be mentored by a wonderful mentor and became interested in these sex-based differences in pulmonary hypertension. So why more women than men develop disease and yet women seem to do better. So this really begged the question of what are sex hormones like estrogen doing to the heart and lungs, specifically the right heart. And so I sort of set out wanting to study this in healthy people first, and we did that in a large epidemiologic cohort called MESA, and identified that some genetic mutations in sex hormone genes are linked to right heart function, and sex hormone levels themselves are also linked to right heart function. So that's kind of given us the background or foundation of being able to now go and look in pulmonary hypertension itself in the disease state. And we're looking at some interesting things with hormonal variations, such as the menstrual cycle. So what's going on with hormones and their fluctuations over the course of the menstrual cycle, and markers of their heart and lung function over their time. What's going on in menopause, what's going on as men age. And so we're hopeful that by identifying and then studying these pathways, we may be able to explore sex hormone manipulation as a treatment strategy in pulmonary hypertension. And that work is starting to happen now. So it's a pretty exciting area, and it's one that's involved collaboration with, basic scientists all the way up to the clinicians. I've been excited to be in this area. I also have an interest in extracorporeal life support and refining clinical practices and developing quality metrics around the provision of ECMO and ECLS. ECMO involves the modification of a traditional heart-lung bypass machine. We use that machine outside of the operating room to basically provide heart and lung support for patients with advanced heart-lung failure. And this has really been a newer strategy on the scene in critical care since some of the flu epidemics, particularly the H1N1 epidemic of 2009. And since that time, we've gained experience with using the technology, minimizing side effects and risks, and have really put it to use in a number of patients and had very good outcomes here. And so we are also excited about the growth of this program. So one of the things that I've been very excited to participate in is one of our Centers of Biomedical Research Excellence Awards. This is a large project grant that's funded by the NIH, and it's an opportunity for junior physician scientists to collaborate with other scientists. And so in my case, I'm a clinician researcher working with basic science researchers in the area of endothelial biology and the cardiopulmonary interaction. And this has been a great opportunity for me to really push myself as a researcher to develop methods and lines of thought that I hadn't previously developed, and has really paved the way for me to submit more grants and hopefully have productive work because of it. And that project is really going on in many ways across the institution with other COBRAs in other areas such as stem cell biology, cancer biology, and there's a tremendous amount of collaboration that happens from these centers being available here.